morning, everyone. The Argentine Consulate General and Promotion Center in Barcelona welcomes you to this session in which 5 Argentine small and medium enterprises will present their products and services related to artificial intelligence and medical simulation and training. First of all, I introduce you to Matías Biancucci, the co-founder of Mirai 3D. Mirai develops patient-specific solutions for surgical planning and simulation by combining 3D printing and augmented reality technologies. They work with multiple clinics and surgical teams over more than 5 Latin American countries, and their next challenge is to launch operations in the European market.
Well, hi everyone. It's a pleasure to be here presenting our talent and our abilities to the world. I will be talking in the name of Mirai 3D. My name is Matías Biancucci. I am the CEO and co-founder. And at Mirai 3D, what we do is we offer surgical planning and simulation solutions. And I would like to start talking about a little comparison between aviation and healthcare, specific about surgery. So I would like to ask you a question that can seem obvious to many of you, but for me, it doesn't make any sense. And it's why aviation is so much safer than surgery. Why, when you are going into a plane, you are happy, you are willing to start your holidays, and when you enter an operating room, you are worried about what will happen, you are afraid, you are worried about something that can go wrong. And this for me doesn't make sense because in an operating room, they cure you, and then you can take a lot of planes, you can go on holidays, your life will be better after surgery. But this happened for a reason, and it's that medical errors are the third cause of death in developed countries. This is a Johns Hopkins study, and this is the third cause of death after heart disease and cancer. Just to have an idea of the impact, the size of this problem, this represents more than 500,000 deaths every year only in the US. But why this is happening? Well, let's keep on this comparison between aviation and healthcare. While aviation uses super sophisticated simulators, many surgeons and doctors still train using ancient techniques, using animal or corpses to boost their training. While in aviation you have super sophisticated technology to plan the roadmap to each destiny, we still use 2D images to plan surgeries. And then both activities have an overtime, which is the flight or the surgery. So it's obvious why one achieves much success rate than the other. The good thing here is that we have a solution, and it's that we can reduce the medical errors and offer better treatments for heart disease and cancer patients, avoiding obviously all these medical errors and caring life. How? Well, from Mirai 3D, we developed 2 different types of solutions, a combination of 3D printing and augmented reality solution for surgical training that you can see at the left of your screen, and 3D patient-specific models that you can see at the right of your screen. For example, here you can see a new project that we are developing that is a totally operable kidney, 3D printed, that we added a virtual reality environment, and this allowed the surgeon to perform more than 15 surgeries in just one phantom and boost their training. And on the right part of your screen, you can see, for example, a kidney tumor of a 30-year-old woman being operated in the German hospital of Buenos Aires, or for example, a pediatric pancreas that had been operated in Garaham Hospital. And which is the value that we have and that we're offering to surgeons and to the medical system? Well, doing the exact surgery over the specific patient anatomy before touching the real patient. So this will completely change the situation that we were talking before. Why? Because you will be able to simulate and train in a super realistic environment, learn the specific technique you will perform after. You will have the chance to plan the surgery with the model the accurate anatomy of your specific patient before the surgery, and then for obvious, you will be much more successful when it's time to avoid any type of errors. How it works, it is very simple. We receive the medical images, we design the 3D model, and then we can ship either the physical object or send the file to be remotely printed at your hospital or medical institution in just 72 hours. We have different models according to different institutions. You can have a fully on-demand service. We can also offer the possibility of build your own point of care architecture in your institution with your own printers, or we can even work an hybrid system where you can have some machines inside your hospital and some technology inside your hospital, for example, augmented reality vision rooms. We can get technology outside the hospital in order to improve the cost efficiency of your investment and of the whole service. What is interesting about Mirai is that we are not just providing a service, we also help you evaluate the cost-effective impact in your institution. That's why we built a web platform where each surgeon, medical manager, and doctor has its own user, and they can see different screens according to their interests. In particular, I would like to talk about the manager view, that you will be able to see a report of in which areas of your hospital the 3D printing and augmented reality technologies are being used, if they are reducing surgical time, if they are improving patient outcomes, and you can see clearly with that panels the impact of this technology in your hospital, because we can assure you that this is completely cost effective and it will allow you to provide a better surgical care, reducing costs. Nowadays, with the on-demand services for specific surgical teams, which are $385 per surgery, specifically for cardiovascular, pediatric, and oncological cases, and then customized plans for each clinic or institution. Since we started in 2017, we have done more than 160 surgeries. We have been able to work in more than 5 countries from Latin America and provide services to many countries in the world, such as Israel, even Spain, United States, United Kingdom. And we have also been recognized with some prizes for our exports and for our innovation. But the most important thing for me is that we are not just the typical startup that starts showing prices or sales or whatever, if not that we are really working next to the surgeons in many institutions. And here you can see how we have done lots of surgeries, either in thoracic cases, neurosurgery, traumatology, cardiovascular, pancreatic, oral and maxillofacial surgery. So these are all real cases done by us in different institutions. And here you can also see how the doctors are using in the operating room our models. You can see all this at this link, and this is what is more important about Mirai 3D, that you will be able to see in this place that we work either with public or private institutions, and that we work values, that is that these technologies and these services don't have to be something only for a specific little part of the population. If not, this has to be able to all of us in order to improve healthcare. The most important thing of Mirai is the people that are doing this. Lucas and Santiago, my partners and co-founders, they have a background in biomedical engineering. Lucio, that is our industrial designer with a lot of expertise in the development of medical devices. Agustina, that is finishing her studies in biomedical engineering, and then a marketing and sales team that supports all our operations. And to end with this presentation, I would also like to share with you some advances that we're doing. because we know that many of you might be thinking that our bottleneck is in the generation of the 3D models. You might say, okay, if you want to scale, you will need every time more engineers in order to attend the demand. So we are trying to automate this process with artificial intelligence. We are building machine learning algorithms that have the chance of getting the medical image, segmenting a specific region of interest, and automatically accelerate a lot this process of 3D modeling with very high accuracy. And this is what you are seeing here. We have started in the urology area, and we are willing to progress over the different specialties of surgery. So to go back to the first slide, and especially in this COVID time, coronavirus time, you might want to go on holidays and to go on vacations. So I would like to remember that one safe surgery can give you hundreds of safe vacations. And this is one of the many things of why this is important. Help us shaping the future of healthcare, and thank you very much.
Next, Rodolfo Giro, co-founder of Interbrain Innovation, and the Dr. Fabián Cremaschi of the National University of Cuyo will refer to how Interbrain Innovation focuses on the acceleration of the learning processes of organizations through interactive and innovative methods, such as virtual and augmented reality simulators, by learning by doing in risk-free environments, evaluating competencies and performance of the participants.
Thank you. Good morning, everyone. My name is Rodolfo Giro. I am one of the co-founders of Interbrain. I don't know if you are watching my presentation.
Yes, we can see it.
Okay, thank you. Well, this project is Sala Simulator. It's a neurosurgery simulator. This project is from Cuyo University. We are here in Mendoza, Argentina. So we work with the university to build this project. Interbrain make the technology, and the university give us the knowledge. So this project, the director of the project is Dr. Fabián Cremaschi. He's neurosurgeon. So he has a very important mission in this project. His mission was teach us about how you have to make a brain surgery. So it was a very, very difficult challenge to make us, we are engineers, to learn how to do this kind of surgery. So he's here with me at the presentation. So if you have any question about the medical process, you can talk with Fabián directly. So, well, what is this simulator? Well, first of all, it's a high fidelity sim for computer. It's an immersive simulator with virtual reality. So the training is we try to recreate the whole process from the office to the operation room. So the idea is to recreate the specific tools and the way you have to use to make this surgery. The most important thing is to select the correct tomographies to know where is the tumor. The first case of study we are working on is the brain intervention to take a tumor sample from the brain. So, well, this is a virtual reality simulator with haptic feedback. that means that the doctor can, the people who makes the simulation can feel in their hands how is the sensation, like, well, to make a cut, or to, for example, when you use some tools to open the brain, things that open the bone, you feel that on your hands. So we use two main hardware tools. One is the Oculus Rift virtual reality device, and the other is the optical feedback with 3D system touch. This small device here is not so small. It's like a PC. The size is not so small. So with this device, you can feel in your hands the sensations. Well, the simulator have many scenes, and start here at the office. In the office, you first of all you have to make the pre-surgery procedures, like a checklist, and you can, in this place, you can learn how to use virtual reality. The idea of this room is to make an environment for the user to learn how to use the devices and how to feel the environment, the virtual environment. Then we put the user in the tomography room, and here you have to build, or you have to put the stereotactic frame on the patient. And then here's, for example, these are actually a picture for the simulator. And when you put the stereotactic frame, you have to select the correct tomographies from the tomography rooms, and then you go to the operation room, and there you have to put everything in place and prepare the patients for the surgery. I'm going to show you one video about how the simulator works, and please let me know if you are watching the video.
No, Rodolfo, we cannot see your video right now.
Okay, maybe I have to change something here in the presentation. I'm going to change here. I'm going to share all my screen. And
Okay,
then
Rodolfo. Now we can see it.
So, well, there's the first steps, the pre-surgery checklist, and the room that the user can learn how to use virtual reality. Well, the idea of this simulator is to recreate Parkinson surgeries. So now we can make the tumor sample surgery, but the idea is to start with this, but continue with the Parkinson simulation. You can walk around the patient and you can move like real life, and well, you have to develop the whole process with all the tools.
Rodolfo, we can upload your video into our account so everyone can see it later also.
Yes, yes.
We can also, after you give way to the next presentation, if you're
Okay.
you're done with explaining your product.
Well, I don't know how many minutes I have, but I think we are now near to the minutes. I don't know. Well, I'm going to move a little faster.
Dale, chacho.
Well, that's our presentation. So, well, the important thing here is we are working with the university, so we can, we are trying to, of course, improve the simulator with more to make a portable simulator also, because the whole devices goes inside the box like a kind of bag, a big box. But the idea is to take this simulator to the classroom to make training for students.
Thank you very much, Roberto, for your presentation. And next, you will be addressed by Dr. José Herrera, the President of Estudio de Tres, offering solutions for the medical simulation industry. So now, José, you may start your presentation.
Good morning. Okay. Good morning. Hello, everyone. My name is Jose Herrera. I am a surgeon specialized in mini-invasive surgery, and I'm chief of department of the simulator department of the Argentine Society of Surgery. We work with Estudio de Tres for the medical simulation industry. The next, please. And there are at least three factors influence in the surgical training market. First, the technology innovation represents a constant change in surgical technique and strategies. And the high demand of the mini-invasive surgery, maybe in USA, about half of the surgery are performed with a minimal invasive technology, but the minimal invasive surgery require a specific psychomotor skill. And the last, finally, the focus on patient safety. The focus on medical training is higher as a consequence of a growing rate of morbidity and mortality due to medical errors. The next, please. And in early 2020, a new factor has emerged: the interruption of surgical training due to the COVID-19 pandemic. And this situation forces us to reflect and ponder will the quality for our surgery drops? Will the safety of the procedure be affected? And how can we incorporate new technologies? And the next, please. We work on solutions for surgical training that will adapt even to the current circumstance. The hardware, we have designed and developed box trainer and educational modules that allow tailor training. The software solution, the follow-up of the training process is paramount important in the acquisition of the new skill. For this, we are building tools with diverse functions, such as the recording feature and the share session feature of the training. Each organization of training program will have feedback and debriefing feature that is independent and private. And finally, the end goal is for each surgeon to have an analytic portfolio and a track record of training. I will show you our video. It's a short video with our work since 2017. We start with the Argentine Society of Surgery, build the first laparoscopic training. This is our simulator training. In this case, we can introduce in the market the mixed simulator trainings. You can see with high reality, high quality models mixed in ex vivo tissue with silicone scenarios. The reality is very high, and this is the view into the simulator box trainings. Remember that we make the first simulator trainings hybrid for laparoscopic and endoscopic skill. And you can see our view for endoscopic view skill in the same simulator training. This is for echoendoscopic skill in other hospitals around Argentina and in Chile too. This is our model for robotic surgery. We have 2 models, and we have on-demand solution. This is for Cook Medical, for the endovascular trainees. This is our models in 3 models in print. This is our software and education platform for big data during the training. This is a learning curve. Finally, this is our other program, how hands-on web is recently put in the market. I will continue with my presentation. I will show you our experience. We have 5 years of experience in the simulator field, with more of 150 simulators distributed among 9 countries, 2,000 sources, in 20 training centers, university, and scientific organizations in South America and Caribbean. And in working process, since March 2020, we have incorporated a new method, surgical training, that we have called HOW. HOW is a hands-on web. It's a method of distant learning that allows simulators in different locations to be connected. This connection have allowed the continuance of professional training, even at an international level. And our new simulator, called One for All, has been through is a sustainable instrument due to the rational use of its components and the absence battery that make it easily portable. Also, with the featuring in an ergonomic shape and high impact reliefs is in the interior. Its versatility is determined by the possibility of including different training platforms. And the last Simular app is our analytic data storage platform, which will all programs and training center to perform close follow-up of their participants. And the last slide is one half of our team at Studio de Tres. I hope you have enjoyed the presentation as much as we enjoy developing solution for surgical training. And this is the last, and thank you very much. Thank you, Hugh, for the invitation.
Thank you very much. Now, Fernando Palacios, the CEO of Neural Actions, will present his platform that enhances cognitive therapies through emotions. Fernando, you may start your presentation.
Good morning to everyone. Can you hear me?
Yes, we can hear you.
Perfect, thank you. Thank you very much. It's a pleasure for me to present our product at this event. My name is Fernando Palacios. I am the CEO of Neural Actions. Neural Action is a platform that enhances cognitive therapies through emotions. We propose a remote and personalized therapy for patients with Alzheimer's or other cognitive dysfunctions. Under this model, we promote equity in health. We are in a growing stage, seeking to provide institutions, professionals, and families an option to humanize treatment and improve the health of patients. We seek to grow in the Spanish and European market with the best benefits that our product can provide. I would like to start with 2 questions. Did you know the memories that last the most are those related to emotions? Even after a long time, the feelings are the same. If emotions were strong, deeper is memory. However, what if we could connect our emotion using artificial intelligence? We propose to create an intelligent network of memories and interests related to the patients, which can connect emotion, passion, and memories. Collaborative artificial intelligence begins to be applied when families and professionals build together. The therapeutic network focuses on the person with cognitive impairment. Each memory is linked and neural actions begins to recommend them to be able to travel the network. This way, the patient has a memory path that he can use as he likes to be able to remember from emotion and passion. We believe that a more personalized treatment rebuilds bonds, activates feelings, and strengthens the affective cycle. This allows family and friends to collaborate with the most valuable information, memories, and anecdotes so that caregivers know about the person's history, and professionals carry out cognitive therapies, achieving better results and without effort from the part of the patients. Let me show you a demo. From a fictitious person, we can use the option, for example, what is my name? Neural actions begins to recommend the person interest, and if we talk about passions, we can evoke, for example, an idol from his childhood. We can also explore his childhood memory, like neighborhoods, and talk about it. Here we have embedded a visualization of the street of his house to being able to take him on a visual tour and ask him questions like what was his house, who were his neighbors. Taking a tour of other emotions, we can talk about what the Parroquia Santa Ana means, which is the place where he got married, and ask a question like, what do you remember from that moment? Who attended his wedding? Always focusing on place that represent emotion. We can ask him where is the located, what's around. For example, in this case, the church is near Plaza Catalunya, and be able to take him a tour in Barcelona. We can talk about his wife and ask him about her name and what her phone number. And from here, we can talk about his interest or preference. For example, if we search for the phrases about likes, we can see that he likes to watch soccer. And then we can visit a football stadium and ask him where did she sit, what game did he watch, what does he remember, and then talk about one important to him. There are many therapies oriented to the passion or the soccer. In Argentina, there is a project brought from Barcelona called Football versus Alzheimer. To evoke memory through patients. About music preference, we can listen to some music to move him to some special moments. In England, there are several projects using music therapy. And then we can talk about hobbies. For example, what does he likes to do? In this case, he likes fishing with friends. This way, we can access to an anecdote to ask for some more specific information about fishing, or we can ask him what are the names of his friends. Also, we can find an anecdote with his daughter and ask him details about this. We can also add to this network the photos of his daughters, Martina and Milagros. All this network built by the professionals the professional. If we use the word help in the search engine, we can get very useful information, like the phone number of his daughters and wife, or detail of where he currently lives and how to get back home. Here, for example, we see the Google Maps, and we can take an imaginary walk around the place where he lives, asking for buildings or monuments that we can see around. There are different ways to use neural actions. In the free mode, the member of a family will be able to access to the same board and can add an anecdote and memories. Neural action gives family free use as a contribution to society. In independent professionals, we have the ability to use one dashboard per patient, shared with the family. The largest team of professionals will be able to perform the therapies and share their experience with professionals in their area. The corporate modality is intended for health institutions that will be able to size the number of boards necessary according to their needs. We are official sponsor of your memories, and we strongly believe that they have high value and can connect us with our deepest emotion. Thank you very much.
Thank you very much, Fernando. And now our last speaker for this session will be Alejandra Sanchez, Quality Manager from GNL Group, an Argentine company with more than 25 years of experience providing IT services and business solutions, which is acknowledged both local and international markets. Focused on avant-garde innovation to respond to market constant challenges, GNL has developed two health products, Rehabictus and H&H. Alejandra, you may start your presentation.
Good morning, everyone. Today, GNL Group wants to introduce you to our health area. Now, we will see a presentation with two of our products for healthcare and monitoring treatment.
GNL Group Health is an area dedicated to developing solutions for care and monitoring focused on different pathologies. Rehabictus, platform that makes it for patients to carry out large an app, web platform, and bracelets that monitor movement. Platform that allows automatic supervise and prevent risk in the monitoring and care of patients. Rehabictus. Who is it for? Rehabictus is focused on the sector of the population that has suffered an accident and that seeks to have a follow-up in the rehabilitation. The joint technological development devices based on AI for the rehabilitation of hemiplegia and hemi-neglect. Who manages the evolution? Product allows patients in clinic or the affected person himself to use the application in a simple way. Bracelets are specific for each type of pathology. The mobile application will receive the data from the device that monitors relevant patient custom levels, frequency defined by a specialist, tutorials. Mobile app. Easy to use. Timers, the user gets ready to do the exercise. Indicates how you are doing the exercise and the time remaining. Users' achievements, calendar. Web platform professionals will be able to access patients' data, establish the frequency of exercise, write down observations, graphs of their evolution, details of the exercises, and achievements. Patients can also view the data related to the account. Home and hospital. Product focuses on population with prolonged treatment. Main benefits. Monitoring patient health status, access to beds rotation and availability, communication with device for capturing indicators, significant cost savings for your organization, portal of doctor-patient. The web application is used by the administrator who provides the basic data to the application loading of medications, diagnosis, treatments, etc. It's also used by the doctor and health professional to follow up patients. Mobile application is intended for patient use. It has several functionalities: appointment alert, medications and treatments, medication alert, medical results, search for pharmacy, appointment access, font operation, pharmacy search. Access to the data of the assigned specialist and immediate chat with him with chat history. Professional search, chat. It is also possible to access use workshops. If the patient has a device for measuring temperature, blood pressure, blood oxygenation, he can transmit it to the mobile device and share it with the doctor by sending it to the web hub. From the web platform, the doctor can behavior, order exams, consultations for medication. With all the data collected during the treatment, it's easy to analyze, create control panels, preparation of strategies, and apply segmentation. H&H contributes to the improvement of results, facilitating the monitoring of patients, reducing the rates of recovered patients, and therefore producing significant savings for the entities that adopt it. In another group, we have Victor.
Thank you very much for your presentation, and thank you to everyone who attended our session today. We remind you that this afternoon at 2:10 we will have another session in which 5 more Argentine companies will present their products and services related to clinical research solutions, telemedicine solutions, Tele-Rehabilitation solutions, and the companies presenting will be Ensayo Para, MOTMI, OMNIA, OSANA SALUD, and Llamando al Dr. So we hope you can attend this afternoon to the next session. Thank you, everyone.